What if I told you that your kidneys could be slowly failing right now, and your body might already be showing you the warning signs every single day? The scary part is that kidney disease is often called a silent disease because many people don't realize they have it until significant damage has already occurred. But here's what most people don't know. Before kidney disease becomes dangerous, your body frequently leaves clues that you can actually see with your own eyes. Maybe you've noticed swelling around your ankles. Perhaps your urine looks different than it used to. Maybe you're constantly tired, your skin feels itchy, or your face looks puffier in the morning. Most people dismiss these symptoms as stress, aging, lack of sleep, or simply being too busy. But sometimes these seemingly harmless changes can be your kidneys asking for help. Today, we're going to uncover 17 visible signs of kidney disease that many people overlook. Some of these warning signs may surprise you because they don't seem related to the kidneys at all. Yet they can provide valuable clues about what's happening inside your body. Make sure you stay until the end, because the final signs are among the most commonly ignored, and recognizing them early could help you seek treatment before serious complications develop. Your kidneys work 24 hours a day to keep you alive. The question is, are you paying attention to the signals they're sending you? Let's begin with the first warning sign. One of the biggest misconceptions about kidney disease is that it always causes obvious pain or dramatic symptoms in its early stages. In reality, kidney disease often develops slowly and quietly, allowing damage to progress for months or even years before a person realizes something is wrong. That is why paying attention to visible changes in your body is so important. Your kidneys perform several essential functions every day, including filtering waste products, balancing fluids, regulating minerals, and helping control blood pressure. When they begin to lose their ability to perform these tasks effectively, your body may start showing warning signs that are easy to overlook. You may notice that your face looks puffier when you wake up in the morning. Your shoes may feel tighter because your feet and ankles seem swollen. Your skin may appear dry or unhealthy, or you may feel unusually tired despite getting enough sleep. Some people notice changes in their urine, while others experience persistent itching, difficulty concentrating, or unexplained weakness. Because these symptoms can develop gradually, many people blame them on aging, stress, lack of exercise, or a busy lifestyle. Unfortunately, this delay in recognizing the warning signs can allow kidney damage to worsen over time. What makes kidney disease particularly dangerous is that the kidneys are remarkably resilient organs. They can continue functioning even after losing a significant portion of their filtering capacity. This means that by the time severe symptoms appear, substantial damage may have already occurred. The good news is that early detection can make a tremendous difference. By recognizing visible signs and seeking medical evaluation when something feels unusual, many people can slow the progression of kidney disease and protect their long-term health. Your body often speaks before a serious health problem becomes an emergency, and learning to recognize these messages may be one of the most important steps you can take for your future well-being. One of the clearest ways your body can reveal kidney problems is through changes in your urine. Since the kidneys are responsible for filtering waste products and excess fluid from the blood to create urine, even small disruptions in kidney function can lead to noticeable differences in what you see in the bathroom. Unfortunately, many people overlook these changes or assume they are temporary when they may actually be early warning signs of kidney disease. A common sign is needing to urinate more frequently than usual, especially during the night. While this can happen for many reasons, persistent changes in urination patterns should not be ignored. Some people notice the opposite problem and begin producing less urine than normal. Others may observe that their urine appears darker, cloudier, or has a different odor. Blood in the urine is another warning sign that requires immediate medical attention because healthy kidneys normally prevent blood cells from entering the urine. Foamy or bubbly urine is another important symptom. While occasional bubbles are usually harmless, persistent foaminess can indicate that protein is leaking into the urine. Healthy kidneys typically keep protein in the bloodstream, so its presence in urine may suggest that the kidney's filtering system has been damaged. This condition is often one of the earliest signs that something is wrong. Some individuals also experience discomfort, pressure, or a feeling that the bladder is never completely empty. Although these symptoms can be linked to other urinary conditions, they should never be dismissed when they occur repeatedly. The key is to pay attention to changes that persist over time rather than isolated incidents. Your urine provides valuable information about your overall health every single day. It acts like a window into how well your kidneys are performing their critical filtering role. Recognizing unusual changes early and discussing them with a healthcare professional can lead to earlier diagnosis, more effective treatment options, and a greater chance of preserving kidney function before significant damage occurs. Swelling and fluid retention are among the most visible signs that the kidneys may not be functioning properly. Healthy kidneys continuously remove excess water and sodium from the body, helping maintain the right balance of fluids. When kidney function begins to decline, this process becomes less efficient, causing fluid to accumulate in tissues where it does not belong. As a result, certain parts of the body may begin to appear swollen, puffy, or larger than usual. One of the first places people often notice swelling is around the eyes, particularly in the morning. The face may appear puffier than normal, and the eyelids may look swollen even after a full night's sleep. As fluid retention increases, swelling can also develop in the feet, ankles, and lower legs. Some people find that their socks leave deeper marks on their skin, or their shoes suddenly feel tighter despite no change in weight. Others may notice swelling in their hands, making rings feel uncomfortable or difficult to remove. This swelling, sometimes called edema, occurs because the kidneys are no longer removing excess fluid effectively. In some cases, damaged kidneys may also allow protein to leak into the urine. Since protein helps keep fluid inside blood vessels, losing it can cause even more fluid to move into surrounding tissues, worsening the swelling. The result can be persistent puffiness that does not improve with rest or changes in daily activity. Fluid retention can affect more than appearance. As extra fluid builds up, some people experience feelings of heaviness, reduced mobility, or discomfort in their legs and feet. In more advanced cases, fluid may even accumulate in the lungs, leading to shortness of breath and reduced physical endurance. Because swelling can have many causes, it is important not to jump to conclusions. However, when swelling appears without a clear explanation, persists for days or weeks, or gradually worsens over time, it should be taken seriously as a potential warning sign that the kidneys are struggling to maintain the body's delicate fluid balance. Many people are surprised to learn that kidney disease can affect the way you look and feel long before it causes severe kidney-related symptoms. Because the kidneys help remove waste products from the bloodstream, declining kidney function can have effects throughout the entire body. When waste and toxins begin to accumulate, they can influence your skin, energy levels, mental focus, and overall physical appearance in ways that are often mistaken for stress, aging, or a busy lifestyle. One of the most common complaints is persistent fatigue. A person may get a full night's sleep yet still wake up feeling exhausted. Simple daily tasks that once felt easy may suddenly require more effort. This happens because kidney disease can contribute to anemia, a condition in which the body does not have enough healthy red blood cells to deliver oxygen efficiently to tissues and organs. As oxygen levels decrease, feelings of weakness, tiredness, and lack of motivation can become more noticeable. The skin may also begin showing visible signs of trouble. Some people develop unusually dry, rough, or flaky skin that does not improve with moisturizers. Others notice changes in skin tone, a pale appearance, or an unhealthy-looking complexion. These changes can occur because the kidneys play an important role in maintaining the balance of minerals and nutrients needed for healthy skin. When that balance is disrupted, the skin may be one of the first places where problems become visible. Difficulty concentrating is another symptom that often goes unnoticed. Individuals may find themselves becoming forgetful, mentally sluggish, or unable to focus for long periods. Since the brain relies on a healthy bloodstream free of excessive waste products, declining kidney function can affect cognitive performance as well. When persistent fatigue, skin changes, and mental fog occur together, they should not be dismissed as normal consequences of getting older or living a stressful life. Sometimes these seemingly unrelated symptoms are part of a larger picture, revealing that the kidneys may no longer be performing their vital job as effectively as they should. Some of the most important warning signs of kidney disease are also the easiest to ignore, because they often seem harmless or unrelated to kidney health. Many people expect kidney problems to cause pain in the lower back or obvious urinary symptoms, but the reality is that kidney disease can reveal itself through subtle changes that affect everyday life. These hidden symptoms may develop gradually, making them difficult to recognize until they become persistent. One common symptom is ongoing itching that cannot be explained by allergies, dry weather, or skin conditions. When the kidneys are unable to effectively remove waste products from the blood, toxins can build up and contribute to widespread itching. This discomfort may affect different parts of the body and often continues despite the use of lotions or other skin treatments. Another overlooked sign is muscle cramping, especially in the legs. Kidney disease can disrupt the balance of important minerals and electrolytes, increasing the likelihood of painful cramps that occur during the day or at night. Bad breath or a persistent metallic taste in the mouth can also be a warning sign. As waste products accumulate in the bloodstream, they may affect the way food tastes and alter the smell of the breath. Some people find that foods they once enjoyed suddenly seem less appealing. This can contribute to a loss of appetite, which may eventually lead to unintended weight loss and nutritional deficiencies. Nausea is another symptom that may appear without an obvious cause. Individuals may feel mildly sick to their stomach on a regular basis or experience a general sense of discomfort after eating. Because these symptoms are common in many conditions, they are often dismissed or attributed to digestive issues. What makes these hidden signs particularly important is that they can appear before more serious symptoms develop. When persistent itching, muscle cramps, changes in taste, poor appetite, nausea, and unexplained weight changes occur together or continue over time, they may indicate that the kidneys are struggling to remove waste effectively. Paying attention to these subtle signals can help identify potential problems earlier, allowing for medical evaluation and intervention before kidney damage becomes more severe. Recognizing the warning signs of kidney disease is only the first step. The most important action is knowing when to take those signs seriously and seek medical attention. Many people wait until symptoms become severe before talking to a healthcare professional, but kidney disease is far easier to manage when it is identified early. In many cases, early detection can slow progression, reduce complications, and help preserve kidney function for years to come. If you notice persistent changes in your urine, swelling in your feet or around your eyes, unusual fatigue, itchy skin, muscle cramps, or other symptoms that continue for several weeks, it is important not to ignore them. While these symptoms do not automatically mean you have kidney disease, they do warrant further investigation. A simple urine test, blood test, or blood pressure check can often provide valuable information about kidney health and identify potential problems before they become serious. Certain individuals should be especially proactive about monitoring their kidneys. People with high blood pressure, diabetes, obesity, heart disease, or a family history of kidney problems face a greater risk of developing kidney disease. For these individuals, routine medical checkups can be one of the most effective tools for protecting long-term health. Even if no symptoms are present, regular screening can detect changes before noticeable damage occurs. Lifestyle choices also play a powerful role in kidney protection. Staying hydrated, maintaining a healthy weight, controlling blood sugar and blood pressure, exercising regularly, limiting excessive salt intake, avoiding smoking, and using medications responsibly can all support kidney function. Small daily habits may seem insignificant, but over time they can have a major impact on preserving the health of these vital organs. Your kidneys work around the clock to filter your blood, balance fluids, and support countless functions throughout the body. They often give subtle warnings when something is wrong, But those warnings are only useful if they are recognized and acted upon. Taking symptoms seriously, seeking professional advice when needed, and making healthy choices today can help protect your kidneys and support a healthier future for years to come. Here's a strong concluding section for your speech. As we come to the end of this discussion, remember that kidney disease rarely appears without warning. The body often provides clues long before serious damage occurs, but those clues are easy to miss when we are busy, distracted, or unaware of their significance. From changes in your urine and swelling in your feet, to persistent fatigue, itchy skin, muscle cramps, and unexpected changes in appetite, these symptoms may be your body's way of telling you that something needs attention. The most important message is not to panic, but to stay informed and proactive. Many kidney problems can be managed more effectively when they are detected early. A simple conversation with your healthcare provider, routine blood work, or a urine test could reveal valuable information about your kidney health and potentially prevent future complications. Your kidneys work every minute of every day, filtering waste, balancing fluids, controlling blood pressure, and supporting countless functions that keep your body running smoothly. Yet most people don't think about their kidneys until something goes wrong. Don't wait for a medical emergency to start paying attention. If today's information helped you recognize even one warning sign in yourself or someone you care about, take it seriously and consider getting checked. Early action can make a life-changing difference. Thank you for watching, and remember, the sooner you listen to your body's warning signs, the better your chances of protecting your kidneys, preserving your health, and enjoying a longer, healthier life. Stay informed, stay proactive, and take care of the organs that take care of you every single day.